help you, we're going to get you to somebody that can. This is a free service, so we don't charge any fees for any of the work that we do. We also like to say we provide non-biased counseling. So we don't sell any products. We're not there to help say, Joe, you need to do this, and Sarah, you need to do that. We're there to help you understand what all your choices are so that you can make a good choice as a consumer. And what I've discovered over the years is people typically aren't good consumers. They will, I'll use my daughter for example, she'll go and she goes right for the clearance racks for certain things, and other things they'll pay all this kind of money for and they don't even think about it, Insurance is one of those. Sometimes people don't think about shopping around, and so they get tunnel vision with certain companies. And so we want to kind of talk about how can you be a good consumer. I manage the Senior Linkage Line program in Southwest Minnesota, so I supervise that program in the 27 counties. We have an office in Slayton and an office in Mankato, and then we have staff located strategically all around that 27 counties. I also do some contract work for the Minnesota Board on Aging, so I do some training for Senior Linkage Line staff and providers around the state, and then I also write this book for the state of Minnesota, the book that you have in front of you. This is my 6th year writing it. And so they contract with me for my time to write this book, and then I have one of my staff who makes it look pretty, because I'm not going to do everything to make it look pretty. But so this is kind of like a Medicare and You handbook for people in Minnesota. It comes out every fall. We make sure we have it online by October 15th, which is the start of open enrollment. And then as one of the things that happen is as things get updated during the year, we update the online version. Obviously, we're not updating this version, but if you want the most up-to-date information, there's a postcard in the back where you can go online and get the online version if you want. Or if you know of a friend, please take one or take the card and they can call us. We can send it to them or they can access it online. And I am going to be taking you to some pages here to kind of give you some information. Now, I'm trying to do as many of these presentations around our 27 county area as possible so that my staff can stay on the phone. Right now, this has been a really bad year for us, I'll be honest. It's really hard for people to be able to get to talk to somebody on the phone. Tuesday was the worst, Tuesday, because Monday was a holiday for us, Tuesday was the worst I've ever seen it. We had about 80 people at once on the phone and across the state waiting to get through for over an hour. That's really hard for our staff to see that happen. A couple little pointers that I'll give you: don't call first thing in the morning. That's the worst time. You think that might be the best, it's actually the worst. We're also open until 6. Until the end of December, Monday through Thursday. A lot of people don't know we're open that late, so the phones really do die down after 4:30. So if you really need to get a hold of us, if you're not able to do your own research, and I'll try to give you as much information about how to do your own research today, but if you're not and you need to call us, I would say call after 4:30, or just be patient, somebody will answer. Don't think hanging up and calling back later is going to help. It's not gonna. You just need to wait on hold as long as possible, and they'll help you. The other thing you can do is call 1-800-MEDICARE. They are charged with also doing this work, and so and they have much longer hours than us, and they also do hire some seasonal staff. So, okay, are we ready? Okay, let's dive into it. So in Minnesota, we have over 1 million beneficiaries that are on Medicare. And if you look at that million plus people, 40% of them currently have their Medicare benefits through what's called a Medicare cost plan. Now, you live in a county where, if people are from Renville County, you live in a county where those cost plans are going away as of 2019. So if you have one this year, you're not able to keep it next year. And we'll talk in a little bit about why that is. But this has really been the biggest change that I've seen since Medicare Part D started back in 2005. If you look at the next biggest population would be Medicare Advantage plans. And that's where people are getting their Medicare Part A, Part B, and generally their Part D through a private company that has a contract with Medicare to be your Medicare provider. Think about it like Medicare managed care. It's more like when you had employer-based coverage. They are your Medicare. You're turning your Medicare benefits over to a private company. You still are allowed to get the same benefits that you could get under original Medicare. So if you were eligible for a mammogram under original Medicare, you're also eligible for that same service under an Advantage plan. The difference is that they can charge you differently, more or less, and they can have different rules about how you access benefits. You may have to use certain providers. You may have to get things pre-approved. You may have to have a referral to see a specialist. And you may pay more for some services. An example would be if I had original Medicare all by itself, Part B covers lab services at 100%. If I had a Medicare Advantage plan, that may not be true. I may have to pay a percentage or a copay for lab services. Still get that lab service, it's just that I may have to use certain providers and I may have to pay a fee for that, okay? Two different ways to get your Medicare benefits, original Medicare or a Medicare Advantage plan. But currently only 29% of people have a Medicare Advantage plan. Now, next year at this time, that's going to look really different, isn't it? You're going to probably see that that is going to be flipped because so many people, people in 66 counties are actually losing their cost plan, so they will not have that as an option. And then we see that we've got 19% of people who are on original Medicare. They get their Medicare benefits through the federal government. They use their red, white, and blue card. And 12% of them also have a second policy called supplement insurance, or Medigap coverage, two words that mean the same thing. You take your Medicare card with you, you take your supplement card, they bill Medicare primary, and then the supplement is there to help pick up the out-of-pocket costs. Now, most people who have cost plans think they have supplement insurance. When I ask somebody, what do you have for insurance, I will tell you 80% of the time, if not higher, they say, well, I have Medicare and supplement insurance. But only 12% of those people actually really do have supplement insurance. Most of them either have an Advantage plan or a cost plan, and they think it's supplement, but it's not. It's a very different way to get your Medicare. Now, let's look a little bit for, do we have anybody that's going to be going on to Medicare? Not quite yet? No. Okay, good. So we'll talk a little bit about what is Medicare. You know, what are the costs going to be next year? So Part A is your hospital insurance. Most people don't pay a premium for Part A. As long as you've worked long enough, or your spouse has, you have to have 10 years of work experience. You need 40 quarters, and you can get 4 quarters in a year. As long as you have 40 quarters through your own work or a spouse, you wouldn't pay for Part A. It's premium free. You've paid for it through payroll taxes over your lifetime. Now, Part B, we do pay a premium for. And that is income indexed. Most people don't realize that if I make more money, I'm going to pay more for Part B. If you make over $85,000 as a single person, or over $170,000 as a couple, you pay more for Part B. Okay? It can be as high as over $400 a month for Part B if you have higher income. Now, only about 5% of the population has incomes high enough that they pay that extra money. But people in our area, it may be farmers who sell land. Because what Social Security does is every year they look at what the income on your last tax return, which was your income the year previous. So it's always going to be 2 years behind. And they look to see, was their income above that 85 as a single or 170 as a couple? And if it was, your Medicare premiums for the rest of that year go up. Okay, about 5% of people. Now, Part A is your hospital insurance. Let's talk about what the costs are going to be if you have just original Medicare. And we've got some hospital gals here, I think, and you have people that are just on Medicare and they have nothing else. We've got 7% of the population in Minnesota. If I was hospitalized under Part A as an inpatient, I would have to pay a hospital deductible if I had no other insurance in 2019 of $1,364. That will cover a 60-day benefit period. Now, a benefit period starts when you enter a hospital, and it ends when you have not been in a hospital or received skilled care for more than 60 days. If you, let's say, were hospitalized again before that 60 days was up, you don't pay that deductible again. But let's say 62 days goes by and you're back in the hospital, you're going to pay that again. So there's not a limit to the number of benefit periods you can have in a year. So that deductible is not per hospitalization and not per year, it's per benefit period. And then if I'm in the hospital past 60 days, which is very unusual, right? Most of the time they want to get you in and get you back out again. But if you were, you would have to pay so much per day, $341 per day for the next 30 days. Medicare will pay someone to allow somebody to be in a hospital, and they'll pay for that for 90 days at a time. If I have to be in a hospital past that 90 days, so on 91st day, I would have to use what are called lifetime reserve days. Every Medicare beneficiary has 60 days sitting in a bank account for them. They're called lifetime reserve days, just in case you need them. They do not replenish. So if I use 1, 2, 3, or all of them, I can't get them back again. If I use them all, I'm never going to get them back. But they're there if I need them. And again, most people will never use them. If I had to, and I had no other insurance, they would cost me $682 a day in copay. Now, Medicare Part A also covers skilled care in a nursing home or a swing bed. If I have been inpatient in a hospital for a minimum of 3 midnights, the day of discharge doesn't count. So I have to be in there at least 3 overnights. And then I go to a skilled center and I have a skilled nursing need, maybe therapy, for example. Medicare will pay up to 100 days. I have to continue having that skilled nursing need in order to go that full 100 days. And a lot of times we're talking about a few weeks. It's unusual for somebody to use that whole 100 days. The first 20 days under original Medicare are covered at 100%. Days 21 through 100, you have to pay a copay if you have no other insurance, $170.50 in 2019. Now, Part B, the Medicare Part B standard premium for next year is $135.50. The standard premium for this year was $134. But we do know that there are people who aren't paying $134. They're paying less than that. And the reason for that is over about the last 6 years, the cost of living increase for Social Security has either not been there at all or it's been really low. And there is a hold harmless provision in the law that says if your Social Security check does not increase enough to pay the increase in the Medicare Part B premium, then we can't charge you that. So there are people that are paying like $128 for Part B, and it's because they didn't get enough of an increase to pay that to take them all the way to $134. Now this year, your cost of living increase for Social Security is 2.8%, highest I've seen it in 10 years. That means that 2.8% will probably be enough to bring everybody up to that $135.50, most people. There'd be a few people that would be paying below that for Part B. Make sense? Okay. Now there's also an annual Part B deductible. Again, this is original Medicare without any supplement. It's not an Advantage plan. I have to pay a deductible before Medicare will pay for Part B services. In 2019, it is $185. I have to pay the first $185 worth of services. After that, most services are covered at 80%. I would pay $20, Medicare would pay $80. Now there's a couple things that are covered at 100%. Lab work is one, and home care is the other. I can get home care benefits under Part A or Part B. Under Part A, it's post-hospital. I've been in a hospital as an inpatient for 3 midnights. I have a skilled nursing need. I meet all the requirements for home care. Medicare Part A will pay for home care up to 100 visits. If I don't qualify, because I haven't been post-hospital, but I still meet all the other requirements, I can get it covered under Medicare Part B. So it depends, yes.
I have a question.
Sure.
Why doesn't Medicare or Part A or B pay anything to like the Mayo Clinic?
Oh, they cover the Mayo Clinic.
Well, I spent 6 days in the Mayo Clinic in
what
Arizona,
state?
down in Phoenix.
Yep.
And they did not pay anything to the Mayo Clinic, they paid it to me. The
it has
checks
to
came
do.
to me and I
Yep.
had to make sure it was paid down there.
Right. It has to do with assignment and who accepts assignment and who doesn't. And providers that don't accept assignment mean they don't accept that Medicare approved amount. And there are some Mayo clinics in various parts of the country where that is an issue. That's also an issue in Minnesota if you come from Iowa. Okay, the same thing would happen. But the reason you don't see it here is because there is a state law, it's a limiting law, that says every provider that takes Medicare must accept assignment. Meaning they can't charge you more than your copay on the Medicare approved amount. Okay?
Okay, I thought maybe
Yep.
it's because they're non-profit, they claim they're
Nope,
non-profit.
it has nothing to do with that.
Okay.
And there's actually a Mayo Clinic that doesn't take Medicare at all, and you wouldn't get reimbursed. And you would have, it's not the hospital, it's a clinic, and you actually have to sign a contract saying you understand that Medicare won't reimburse for that.
Okay.
Okay? Good question though. So, Part B, most services are covered at 80%, and you would be responsible for the 20% after the deductible unless you had other insurance, unless you had supplement insurance to help pay that. Okay? Now, Part A is your hospital insurance, so that's if you're inpatient in a hospital, if you have a skilled care at a nursing home or a swing bed, transfusions as an inpatient, also home health and hospice. Part B, though, is what you use more often. That's your doctors, that's your outpatient surgery, lab work, x-rays, durable medical equipment, ambulance. All of those things are covered under Medicare Part B. Now, what's not great, Medicare is not good about paying for some things. Hearing, dental, and vision are the big ones. Unfortunately, Medicare's great if we get sick. But where they're not so good is if it's experimental or if it's something like dental, hearing, or vision. When I started, they also weren't very good about covering preventive services. They were there, but you had to pay your deductible and your 20%. Well, they found a lot of people didn't access that then if they knew they were going to have to pay some out of pocket. So over the years, they've gotten better at that. Now, if I have original Medicare and a supplement policy, that supplement policy will also not pay if Medicare doesn't pay. Medicare is primary, the supplement is secondary. It's there to help pick up the out-of-pocket costs that Medicare doesn't. If Medicare doesn't cover it, in most cases, the supplement won't either. Now I can, though, if I wanted to get some of these benefits covered, I may be able to enroll in a Medicare Advantage plan. Those plans are allowed to cover things that original Medicare can't. So many of those plans this year do have some dental, hearing, and vision. You know, when we were writing the book this year, we were surprised at the number of plans that have especially extra hearing aid coverage that we didn't see before. Now you got to be careful because just because it says it's got hearing, dental, and vision, what does that mean? How much coverage is it? You know, is it worth that? Because it may not be a lot. Some of the plans will say, okay, we'll pay for up to $120 a year in dental. Well, is it really dental? It's not dental insurance, right? You're getting kind of a discount. So you really have to look at that. Now, if you live in Renville County or one of the other 66 counties where you can no longer enroll in a cost plan, these are your choices. And so it's made it much more simple because cost plans were in the middle. You actually had 3 different ways to go. Now you have 2 different ways to go. Now, I apologize, so hopefully you guys can see me, we're looking on the left-hand side. This is your first way. You can get your Medicare Part A, which is your hospital insurance, through the federal government. Your Medicare Part B, which is your medical insurance through the federal government. You use your red, white, and blue card. And then you enroll in a secondary supplement policy called Medigap insurance. It pays after original Medicare. It's there to help fill in the gaps. Now, it doesn't cover drug coverage, so I can't get my outpatient prescriptions covered under that. I would have to add a separate Medicare Part D policy. So I would have original Medicare, have a card for that. I have a card for my supplement plan, and then I have a third card for my Medicare Part D. So that's one option. The other option is to combine all of that through a Medicare Part C plan, and that is where you get your Part A, your Part B, and most people their Part D through one company. That company has a contract with the federal government to be your Medicare benefits for that 12-month period. So let's say that I enroll with company A and they become my Medicare benefits for 2019. I still have Part A, I still have Part B. It's those Part A and B benefits, though, are through that private company that has the contract. That company is receiving money each month from the federal government to be your Medicare. They assume all the risk, meaning if let's say the company were to get $900 a month. If my health cost that month were $10,000, they're losing some money. If, though, I didn't see the doctor at all that month, they're making some money. They assume all the risk. That is not the way it is with a cost plan, and that is one of the reasons that they're leaving. Cost plans cost the government more money. The way it happens with the cost plan is the cost plan is reimbursed monthly, but at the end of the year they reconcile it. If it's cost more money to care for you than what they got back, they get more money back. They do not assume all the risk like an Advantage plan. Okay, so it costs more money for the government to administer cost plans. Now,
as an example, is UCare?
UCare is an HMO point of service option. It is an Advantage plan.
That's an Advantage.
That is correct. Yep. Now, I have the option to get my Part D through the plan, but there are also several plans that do not include Part D. What's very important to note is the only time you should ever choose an Advantage plan that does not include Part D would be if you have other creditable drug coverage like VA coverage. If I get my drugs from the VA, I've got several of my volunteers who are veterans, and they get their drug coverage from the VA. They don't need Part D. So they would enroll, and a lot of them, they get all of their health care from the VA, pretty much. So they would enroll in a plan like this. It's more major medical. It's really there if they need to go to the local hospital and they can't get to the VA for services. They don't need Part D because they have creditable drug coverage. If, though, somebody says to me, you know, I don't take any medications, and they're not a veteran, they don't have other creditable drug coverage, they enroll in an Advantage plan with no Part D because they think they don't need it, that's not going to work for them. They can do that, but what's going to happen is later down the road when they try to enroll in a plan that does include Part D, or go to this side and enroll in a separate Part D plan, they're going to be penalized. And the penalty is stiff. It's 1% for every month they were eligible but not enrolled. So if I go 2 years, that's 24 months. They'd have a 24% premium penalty, and it's 24% of whatever the national average premium is that year. And this year, so it's going to go up. This year it's around $35. So you paid 24% of $35 and the premium for whatever plan you choose. And you're going to have that penalty forever. So even people, shoot, did that just do that?
It did, yeah, it just hit the back arrow on there. Or
Is that crazy? There we go.
very sensitive.
Thank you. So you really, even if you don't take any medications, you want to choose maybe one of the lowest price plans that works at your pharmacy to protect yourself from the penalty. Don't not take Part D just because you're on no medications, because that can be short-sighted. So these are your choices. Now, it's not like one is good and one is bad. They're just different. They're very, very different. If I go this side, and that's what you guys have, okay? If I do this, what are the pluses for me? The pluses are I can go to any provider that takes Medicare in the United States. I never am going to have to get things pre-approved. There's no referrals to see specialists. It's portable. If I move, I can take it with me. And I'm going to give you an example. My kids and parents live in Iowa. So when I retire, I'll probably move to Iowa to be close to them. Now in Iowa, their supplement plans are age rated, meaning they go up in premium as you age. Ours are community rated. They're the same amount no matter whether you're male or you're female or what your age is. It depends on where you live as to what the premium is. So I would rather have a plan like that. I'm going to buy it before I leave Minnesota, take it with me when I go to Iowa, because I can do that, okay? The other thing, these are very comprehensive. I can get a plan that would virtually pay all of the out-of-pocket costs that A and B did not. Is it because I'm touching it on here?
Yeah, you can't even get too close to
I
the screen or
guess.
it will.
There we go. I'll do it this way.
You need a laser.
Yeah, I do, all right. So I can get a policy where I would pay nothing for the whole year. My out-of-pocket costs would be in that monthly premium. And I have a lot of flexibility, right? Now, I shared a little bit, and this is being filmed, but I shared a little bit earlier that I have an infusion, as I have Crohn's disease, that's every 8 weeks at $7,000. It's a lot of money. If I were on Medicare, that is covered under Medicare Part B, because I have to get that infusion at the hospital, just through the cancer center. So, Medicare Part B, if I only had Medicare, would pay 80% of that $7,000. If I didn't have anything else, I'd have to pay that 20%, really high, right? I need supplement insurance because it'll pay that 20% for me. Even though the premium, because the negative here is this is expensive. Okay, this is a lot more expensive. But I have enough health-related costs that for me, it's better for me to pay a higher premium and pay no other out-of-pocket costs. If, though, I had it here, under Medicare Part C, or those Advantage plans, Medicare Part B medications are sometimes 0 to 20% out of pocket for you as a beneficiary. Sometimes it depends on the drug, depends on where you get it, depends upon the plan. It would, even though the premiums are a lot lower, that's not a good option for me because of my health costs. My health costs and copays would be so high, they would cost me more money here than it would here. Make sense? So that's, when you're looking, when you say it's not good or bad, it's about you, right? Now, my husband hardly ever goes to the doctor. I got to drag him there. Why would I want to pay a couple $100 a month for this when he's never going to use it? He's probably going to be just fine over here. He doesn't have a lot of health needs, so those copays are not going to be an issue, really going to be an issue for him. So you really have to look at yourself. You have to think about how much coverage do you need? What are your health risks? Insurance is risk protection. How much comfort are you with risk? How flexible do you want to be? You are going to pay a lot in premium, so you really have to be okay with the trade-offs, which is that higher premium. Now on this side, what am I going to get? Lower premiums, for one thing. You may also get some extra benefits. You may get a little hearing, a little dental, a little vision, and may pay for a membership to a health fitness organization. These plans are also starting this next year going to be being able to offer some Medicare beneficiaries additional benefits like medical transportation, homemaker services, adult daycare, things that they couldn't pay for before. The federal government is now going to allow that. That might be really great for somebody. It just wouldn't for me because my health costs would be so high over here. So you really have to look, and just because your husband gets one thing doesn't mean the wife needs to get the same thing. You really have to look at yourself as an individual. And now the other thing, if I go here, typically, once I pick supplement insurance, I pretty much am with that forever, okay? The reason is, when my Medicare Part B starts, I have 6 months to choose any supplement policy, and I can't be denied because of my health. It can't go through underwriting. They can't even ask me health-related questions. They have to take me. So Part B starts, I've got 6 months. After that, I have to have guaranteed issue rights for them to automatically enroll me in that plan without health screening. I can apply for that at any time after you're age 65, but it's a separate application and it asks health-related questions. It goes through underwriting. You can be denied if you have health issues. I will be denied. Okay, we know that. They're not going to want me. I'm going to be too expensive, so I'm going to have to get that within the first 6 months. Here, the only time they can deny you ever is if you have end-stage renal disease. And that is going to change in a couple years. They're also going to allow those folks to have those plans as well. Now, the reason that I'm spending so much time on this is because those of you that are losing your cost plan, how many of you are losing your cost plan? Quite a few of you. You have guaranteed issue rights. You're losing your health insurance. That's one of the times that you get guaranteed issue rights. It means that you can enroll in this kind of insurance and they can't ask you health-related questions as long as you do it before March 4th. That's after that, your guaranteed issue rights end. But if you do it before that, they are required to take you. You can, depends on the company, but they have to allow you at least a basic with some riders, and I'll go through and explain what that is. You may never get it again. So if when you first enrolled in Medicare Part B, you didn't go this option, and now you think, boy, my health has changed, or I wish I had done that, this is an opportunity for you to do it. You may never get it again. Okay? Make sense? Questions about that? Okay. Now, supplement insurance, and again, remember, everybody thinks they have supplement insurance, but it's really always a secondary payer to original Medicare. You have to have A, you have to have B. Generally, you have to pick it within the first 6 months of going on to Part B, unless you have those guaranteed issue rights. In Minnesota, ours are standardized. So I want you to take your book, and I'm going to have you turn to page 18. I think it's 18. Yes, page 18. So this shows you the kinds of, I'm sorry, it's in this book here. You got it? So this shows you all of the plans and the types of plans and what the coverage is. So if I look at a basic supplement policy, and if you have guaranteed issue rights, they're required to sell you the basic and the first 3 riders. So if I enroll in a basic plan, what is it going to pay? I have to buy a separate rider. So the basic is the entree, and then I have 4 riders that I can add to it. Think about it like desserts and appetizer kind of thing. So the first one is I can add a rider that would pay the Part A deductible. That's that $1,364. Now, although we don't steer anybody, I'll tell you, I would get that rider. I would get the basic and at least that rider, because that $1,364, even one hospitalization that year is going to sock you, okay? The next rider you can buy is the Part B deductible. Now remember, the Part B deductible next year is only $185. And if you look at the cost of that rider, it's around $15 a month. So you don't save any money by choosing that rider. However, if you know you're going to have $185 worth of care that year, get it, because you're spreading it out over 12 months instead of getting socked right away in January. But you're not losing money by not taking that rider either way. It'll pay for any preventive care. It'll pay for your Part A co-insurance. So remember, after the first 60 days of copay in a hospital, you pay so much per day. It'll pay that for you. It'll pay the 20% for Part B. That's the big one. So under all Part B services, Medicare pays 80%, it would pay the 20% for you. It'll also pay for your blood transfusions in or out of the hospital. It'll pay for your skilled nursing copay. Remember, the first 20 days are covered at 100%. Day 21 through 100, it is $170.50. It'll pay that for you. It'll pay for your occupational, physical, and speech therapy. Now the next one is an excess rider. This is the third rider that you can buy. And remember, we talked about that if I go to a provider and they don't accept Medicare assignment, let's say that the bill from the hospital is $1,000, but the Medicare approved amount is $500. Excess charges allow a hospital or a provider to charge 15% of the difference. So they could charge me 15%, up to 15% of that extra $500. Now in Minnesota, it's against the law. In Minnesota, if I see a Medicare provider, that provider is required to accept assignment. They can only charge me copays on the Medicare approved amount, no difference. The exception would be durable medical equipment, otherwise they can't. If though you're a traveler, let's say you travel to another state, or you use a lot of durable medical equipment, you might want to purchase that rider, but most people will never actually even use the rider. The last rider that you can purchase, because there are 4, is a preventive rider. Medicare does not pay for an annual physical. They pay for an annual wellness visit and a welcome to Medicare physical, welcome to Medicare visit, but not a physical. If you want a physical, you can buy this rider, and it'll pay up to $120 a year towards that physical. And then it pays for 80% of emergency foreign travel. Now remember I said that with supplement insurance, Medicare pays primary and this pays secondary. And then if Medicare doesn't pay, this isn't going to pay either. There's 2 exceptions. This is one of them. Medicare doesn't pay for foreign travel. But if I have a supplement, it'll pay for 80% of emergency foreign travel. The second time is the fact that I can buy that rider that will pay for a physical when Medicare doesn't. Other than that, Medicare has to be a Medicare covered service before the supplement will pay. So that's the basic. Now the next column is extended basic. This is more your Cadillac coverage. It's a lot higher premium. It does have, so it has the basic and all of the riders. It has some extra foreign travel. It's helpful if you're somebody on dialysis because it'll help pay up towards some of your medical transportation. Most people don't need this. This is more coverage than most people need, and it's expensive. So you really would have to need it to pay those extra premiums. And then we have a few lettered plans. This is how plans are sold in other states, by letter. For a lower premium, you're agreeing to pay some of that out-of-pocket costs. Now I want you to turn to page 65. We've got 3 pages here. Supplement insurance, and this was as of October 1. I have a few because in November there was a few companies that raised their prices slightly, so if you're interested in that, I'll have that up front. You can also get it online. We update the online version. So let's look at a couple of these. Let's look at Blue Cross Blue Shield of Minnesota, because I've heard several people have Blue Cross here. If I'm a non-smoker in Minnesota, I could get that basic plan, and remember the big one is it pays that 20% under Part B, for $162.60 a month. If I wanted it to pay that Part A hospital deductible, I would pay an additional $36 a month. So it's a la carte. You buy your basic, and then you can add those 4 riders. If I wanted to pay the Part B annual $185 deductible, I would pay an additional $15.40. If I was a traveler and I was concerned about excess charges, I would pay an additional $1. And if I wanted that $120 towards a physical, I would pay $4 a month. If you add that up, I think it's around $220 a month. Now, if you have guaranteed issue rights, you're allowed to pick that basic and you can add those first 3 riders. The company can give you the 4th if they want, but they're not required to. You are not allowed, unless the company's willing, to get the extended basic. Now, let's look at another one. Let's look at Continental Life Insurance Company of Brentwood in Tennessee. If I'm a non-smoker, the basic plan is $174.58, so it's about $5 more a month than the other. The Part A deductible is $41.50, so that's about $4 more. The Part B deductible, $15.25, and so forth. So that's higher, isn't it? Exact same coverage. These are standardized. Every basic plan is exactly the same. So shop around. Don't think you have to always go with a particular company. Look at what your costs are going to be. It has to cover the same thing. It's no different than buying a gallon of milk. Milk is not the same price wherever you go, right? It's the same product essentially. Now, you may have some differences in customer service. If you're someone who really wants to deal with a particular company or agent, and you're willing to pay more money for that, and you see there's value in that, that's certainly fine. We just want you to go in with your eyes open. Don't think the coverage is more, because it's not that. Okay? Questions on that? Any questions on supplement insurance? Okay, and then you'd have to add a separate drug plan to it. Okay, we've talked about original Medicare. You have Part A and Part B. You pay your $135.50 a month. You add a supplement policy. Depends on the policy you choose, but you're looking at over $200 a month for both policies. And then you add a separate drug plan. And we'll talk about Part D in a little bit. The other option is to go with a Medicare Advantage plan. That is when you get your Part A, your Part B, and your Part D benefits all through a private company that has a contract with Medicare. You have 10 options in your county. Because I did the research for somebody earlier. I had to add 42 pages to this book this year because there were so many other plans that came on board. But it depends on where you live as to which plans you can choose. Because what's available here is not going to be the same thing that's available in Mankato, where I live. It depends on where you are as to what's available. So you really have to look at it. And gentlemen asked me, okay, so if it's sold in this county, I can buy it. Does that also mean it works here at this hospital? Not necessarily. And these plans are sold in certain areas, but then you also have to check. Can I use it where I want to go? And look at every provider you want to see. Don't just look at the hospital or the clinic. Where do you want to have therapy services? What nursing home would you want to go to if you were getting skilled care? Look at everything. Do you want to go to Mayo Clinic? Do you want to go up to the metro area? Make sure you check all of those, because you don't want to get a plan that you can't use. Remember, with an Advantage plan, there's a provider network. Now, you may get extra benefits. Look at those benefits carefully. And in the back of the book, every single plan that's available in Minnesota is listed. It tells you what county, and it tells you what benefits you're going to get. Again, most plans include Part D, and most people need to get their Part D from the plan. Unless you have other drug coverage like VA drug coverage, you don't have to have a plan with Part D. You're okay. You could enroll later if you wanted without penalty. You are going to have out-of-pocket costs. Now, I'm going to give you an example. The last presentation, I met with a gentleman after, and he had been automatically enrolled into a new plan with his company. Some of you probably haven't. The premium, he's trying to decide, do I keep this Advantage plan that I was enrolled into, or do I go with original Medicare and add a supplement? His premium was going to be $198, and that was his A, his B, and his D. Okay? And then we looked at, well, what would it be if you were on original Medicare? If he went with the same company, he could do the basic and the riders for $219. So you're looking at $30 a difference, right, in premium. So on the surface, that might look like, oh shoot, I need to go with that Advantage plan. We had to look closer because when we did his drug research, because your drugs are a part of the package, right? You can't separate it out. His drug coverage under that plan was going to cost him more than $300 more a year. So take that, divide that by 12. So then that makes that other plan a little bit more attractive, doesn't it? And then we looked at what kind of services do you have, and when we started adding up what the co-pays were going to be, he was financially better off to have original Medicare with a supplement and a separate Part D. Now, is that going to be everybody? No, it's not. You really just have to look at yourself. Sometimes on the surface, you may think you need to go one way, but when you start costing it out, it may very well be different. Okay? Questions on that? You guys are too quiet. That other group was really loud and rauncous, and they had a lot of questions, so gotta do that for me.
It's after lunch.
You know, is that good? You're all let's make you do jumping jacks. Now, there's lots of different Advantage plans, okay, so let's talk about those.
You have a question, Rachel?
Yes.
Yeah. I have Blue Cross Blue Shield, okay, I was in the one plan with no co-pays.
So you were the Platinum Blue,
So then they
complete.
shifted it to this Advantage. plan,
Yep.
Which is more, but there's so many more co-pays on that.
Exactly.
And then she explained there's a senior one you can go to.
Right. So Senior Gold is what she was talking about. Senior Gold is like going to Old Country Buffet. You pay one price, it has your basic and all the writers.
Right.
That's about $250 some, if I remember correctly. You could go to just the basic that we just looked at with the writers, and it will be cheaper for you.
Is that on Blue Cross or is
Blue
it?
Cross.
Oh,
You could
okay.
stay with the same company, and instead of doing the Senior Gold, choose their basic, do the a la carte. It'll save you a little money. The coverage is just the same, and with that, you can go anywhere in the U.S.
And with the
Senior Gold actually has a network, but people don't realize you need to use network providers with Senior Gold. Not bad, but because it's a large
Well,
nationwide
and with the
network.
Senior Gold one, you've got to take a separate policy for the medicines.
You will with either way.
Oh,
If you do original Medicare, you will always have to take a separate drug plan. That is not always a bad deal for you though.
Okay.
Because otherwise, if you have an Advantage plan, you take what you get. And so, you know, it may or may not be good for your drugs. You may save money by separating it out. And that's what the gentleman that I talked with earlier today, he would have lost $300 by keeping it bundled. So even though the premium was higher on the basic than the Advantage plan, it went like this as soon as you factored the drugs into it. A lot of people don't think about
Well, I
that.
ran across something with the drug part. It was for an injection drug for physical thing. Okay, they want 188 copay. Okay, I didn't have 188 copay to do this.
That's right.
So I
So you
finally
want-
called Blue Cross.
Mm-hmm.
Blue Cross made an exception, put it at tier 6, and they paid for it all.
Yeah,
A
that
lot
was
of
under
people aren't
Part D.
aware of that.
That's right. You're exactly right.
Yeah, a lot of people are not aware.
No, you're right.
I
People
wasn't
just
aware
pay
of it.
things.
Yeah, I wasn't aware of it.
Mm-hmm.
Well, I was just gonna say, because I just brought my mom in because her plan was gonna be discontinued.
Right.
And that's the one that we ended up going with, was the Senior Gold.
Did they even talk to you about the basic?
The only other one that she talked to us about was the one that was comparable to what she already had. But there,
Was it an Advantage plan?
I don't remember.
Yeah, for some reason.
But the one that she did talk to us about was, a lot of co-pays.
That was the PPO plan.
Okay, a lot of
That was an
co-pays
Advantage.
and having to get things, okayed.
You could go back and say, hey,
Well, we wouldn't want that though.
okay,
Well, she wanted a lot of
just a
co-pays.
second. You could go back and say, hey, we enrolled in the Senior Gold, but you didn't talk to me about the basic with the writers. can save about $30.
Okay.
What's been interesting is that some Blue Cross agents are talking to people about that and others are not.
Okay.
They make more money with the senior.
Well, I do not know if their commission is higher.
Well, here's how it was laid out. This, with all the bad things about this,
Yeah.
and then the total opposite about this.
Right.
And so it was like, well, that's a no-brainer.
No-brainer, why not? Right. And that's where we get into, there's nothing wrong with going to a local agent. We're very lucky in our area. We have some great local agents. But you also want to think about what is their job. Their job is to sell the things that they sell. That's their job. And so we can never fault them for that. What we want you to do is do your research before. Find out what's really good for me. Is it that company? Or even within that company, what are my best choices? Not what do they tell me to do, but what do I look at and is best for me?
Right, well, and between me and Tammy, we take care of all of mom's health and her pills and stuff. And, we both work full-time and such. And so when she started saying that things would have to be pre-approved and this and that,
But see, you could go to
I just
this,
went, oh gosh, I
you could
don't
go to
have time.
this right here and do this. With
Okay.
the same company,
Is that Blue Cross?
same coverage, it's still Blue Cross.
Oh, okay.
It's just that instead of it being the senior gold in a package, you're a la carting it, you're not gonna know the difference.
Okay,
It saves her about $30, and there's no network. So I don't know why your agent didn't talk to you. Most of them are talking to people and actually enrolling them in that instead of the senior gold,
okay,
okay? Both are good products.
right.
It's just if you wanna save a little bit of money, then that would be the way to go, and stay with that same
And
company.
then is there co-pays with that?
There is no co-pays with that, as long as it's a Medicare covered service.
Okay.
What Medicare doesn't cover, it will cover as long as you get the basic and you get the riders, okay?
So what riders would she need then?
So if you wanted it to be comparable to what you had, you would do the basic, you would do that rider, the Part A deductible rider, the Part B deductible rider.
She wouldn't need that.
Then I would just do these two.
Okay.
Unless you wanted to have the physical each year, and then that's additional. But it will be cheaper,
Okay.
okay? Questions over here? So we just want you to be good consumers. We want you to go into it with your eyes open to save the most money. And then if you narrow it down to a particular company, you can certainly talk to an agent. Supplement insurance, you have to contact the company. We can't enroll you in supplement insurance.
Yeah.
Okay, we can only enroll you in Advantage plans and Part D, and you can do that yourself as well.
Well, this year's gonna save us.
I got a question.
Yes?
I'm gonna share, you got 4 different items here for, they and Gloria don't recommend?
Let's go back a minute. So just so everybody can, let's all be on the same page. He's wanting to know about those lines in blue. Okay, I want you to think about, like, when I was a kid in Iowa, we went to Bishop's Buffet. Did you guys have that where you paid so much for your entree? You had your little tray and you said, I'll take that vegetable and this. Maybe you didn't have those here. So you pay so much for your basic. That's your 162 on the Blue Cross you're looking at. And then you can pick extra things. Now, it's a personal decision. You could just take the basic if you wanted.
A and B, they're pretty important.
Well, the A is especially important. And the reason the A is especially important is because if I'm hospitalized, I have to pay $1,364 every benefit period. That's a lot of money. So I think that it's worth the money, is my opinion. But you have to decide what your personal preference is.
Part B,
The Part B, think about it like this. If you get your calculator out and you take that times 12, you're paying the same amount as it's paying. Because the Part B deductible next year is $185. But if you,
that's all it covers is the 185.
that's right. But let's say that you know you're gonna have $185 worth of service. You might as well get the rider because you're paying a little bit each month instead of getting socked in January. You're not, the only people that would lose money on that rider would be people who didn't have $185 worth of services. Does that make sense?
Well,
Yep.
most anybody has
Yep.
that.
So the one that's the most important is the basic and the Part A, whether, and it's really up to you whether you choose any of those four.
But the other two,
The other two, it depends, you know, you can look at, do you travel a lot? Because if you live in Minnesota and you have care in Minnesota and you don't use durable medical equipment, you cannot be charged excess charges. Okay, you guys don't, they just can't, it's against the law.
what about,
But if I go to Iowa and I like, or Sioux Falls, they could charge me excess charges. And so for people who live on the southern part where I work, and they always go to Sioux Falls, they may want to get that rider because then they're going to a provider that's not a Minnesota provider.
what about the last one?
The last one is if you want $120 towards a physical, because Medicare doesn't pay for a physical. If you want a physical every year, they'll give you, and you buy that rider, they'll pay $120 towards that physical every year.
But sometimes, like if you go to Rochester, you're gonna get a physical where you want it or not, to start checking on something.
That's not a physical, usually it's diagnostic. It's when everything is okay with me, I just want to go in, I want you to give me a physical, I want you to check me out and see if anything's wrong. If something's wrong and I'm going for diagnostic services, that's not physical, that's not physical.
I've been there enough times, so I know that something I wanna do is if you wanna get a
Yep.
complete physical regardless.
And if you're somebody who goes to the doctor frequently, you're probably never going to have a physical because you're going as you need services.
So if you're on medication and you schedule your physical, mainly because you need to get your meds re-upped, is that considered a physical or is that diagnostic?
It depends on how, no, it depends on what you ask. If I call the clinic and I say, because Medicare will pay for a welcome to Medicare visit and an annual wellness visit. And you could have your medications looked at during that. But if you call the clinic and say, I want to schedule a physical, they're gonna bill it as a physical and Medicare will deny it because it doesn't pay for it.
So you need to ask for an annual wellness.
Yes, and do you guys ask for that now? In the beginning, they didn't used to. They've learned that.
You tell us you want an annual physical, we'll put you down as a wellness exam.
Oh, okay.
Because they don't want you calling them and saying, why did Medicare not cover this?
Yeah, because I'm sure I booked a physical, but I haven't gotten a bill,
They'll
so.
look to see whether or not you have Medicare in it, but
Okay.
if you do, they'll push it down.
Okay.
One quick question back on that Blue Cross. One other thing that she told us, the difference
Yeah.
of those two was,
Medication.
oh, New York calls me like 3 times a day.
It was only
The other big thing that she said was the difference between the two was that say our mother was hospitalized, she would have to pay $150 per day.
So when you're talking about the difference, though, you're not looking at what I was talking about. So you're looking at senior gold, which is supplement. The basic is also supplement. What you were talking about is an advantage plan, and that does have copays, yes.
But, so in this one that you told us.
That is not there. That is not this. These are all supplements.
Right, so in this case,
You don't pay, yep,
this would take care of that.
exactly.
Okay, I just wanted to
Yes,
verify
you're
that.
exactly right.
Because I'm gonna bring her back.
Bring it back and say, we want basic.
I got another question.
Yes.
A month ago, I was
Hold on just a second, guys, I might have a little bit of a hearing impairment. Go
I
ahead.
had a new pacemaker put in.
Yep.
And I just got the bill the other day or the statement. They billed the insurance or Medicare or whatever, $27,000 some dollars. Medicare, my insurance. They paid $1,300. Now who picks up the rest?
What do you have for insurance?
Medicare, cost plan.
You have a cost plan. It depends on the cost plan that you have. It depends, because there's lots of different medical plans.
Well, this is one you can't have.
We'll get the basic.
Right, but it depends on which medical plan is to what you're gonna pay. You may have some co-pays with that. So you may still get, what?
I owe nothing.
You very well may be. What I would do is call the gals at the billing department and they can tell you whether or not you're gonna owe anything. You would get a statement from, were you hospitalized? Were you an inpatient? Okay, so you would get a statement from Medica if you owed copays. Okay?
Where is come from, I suppose, or is Medicare, where did it be from?
Well, maybe right afterwards, you and I can talk about it. Would that be okay? Okay. Yes.
Okay, so if we did that, rider for Part A,
Mm-hmm.
then that, see, this is what we got, and this is probably what everybody's talking about that they got, because we always Blue Cross. So that would take care of paying that?
Yes.
Okay,
These are advantage.
right, right.
Yep, so what you're looking at is, so let me go real quick. We've got different kinds of advantage plans. So we've got HMOs, and basically if I have an HMO, I need to use providers within the network. I can't go outside of the network and think they're gonna pay. They're only gonna pay if it's an emergency. The next is an HMO with a point of service option. That does allow me to go some out of the network. UCare, for example, have some plans like that. However, anytime you're allowed to go out of the network with any advantage plan, you're always gonna pay more money. A lot of times you'll see it's a fixed cost in network and a percentage out of network, and it can be very high. So you always want to stay within a network if possible. PPO organization, and that's what those are.
Okay,
So a PPO is a preferred provider organization. We have a list of providers we prefer you to use. We will allow you to go out of the network, but you will pay more money. So those of you who have Blue Cross, what's happening is you may have even been enrolled into a new plan, a new PPO plan. Some people were automatically enrolled into a new plan. Medica didn't do that. And that is a PPO plan, and it has your health and your drugs. The premium is a little bit lower, depends on which plan you're looking at, but you do have copays. If you have the basic with that first rider and you were hospitalized, you wouldn't pay anything.
okay.
But you're paying more in premium, so you're paying for that. You have to think about, I'm paying for that benefit. Make
So we
sense?
do see a couple of specialists, so we need to expect that we're gonna pay that $20.
Yes, yes, so you gotta figure that in. So like myself, I have warfarin and I go and have lab work every 6 weeks. So if I was gonna choose an advantage plan, I wanna figure that cost in to that premium because it's built in. I always know I'm gonna have that. So you have to make sure. If I never go, it's not an issue, but if you use a lot of healthcare, you gotta figure that out. Now, we also have some special needs plans. Those are for people in our state who are on medical assistance. They have Medicare and medical assistance and Part D all through one plan. It's an advantage plan with a contract with the county and with the federal government. We have one private fee-for-service plan through Humana. And with a private fee-for-service plan, it means we have a network, but we'll also allow you to see providers outside of the network as long as the provider is willing to accept the plan's payment. Now, many of you had cost plans. Cost plans were very unique. There's only about a dozen states that have cost plans. And they actually were set to leave the market as May as 10 years ago. But they kept getting reauthorized. And what happened, though, is there was a law that was passed, I think it was around 2013, that said, hey, we got to stop. Okay? Any county in the United States that has cost plans, and that county, if they have 2 or more competing Medicare Advantage plans that are available to people in that county that meet certain requirements, they're not allowed to sell cost plans in that county starting in 2019. In your county, you had 2 or more Medicare Advantage plans this year, so that's how they determined you can't get it next year. Sibley County can keep their plan this year because they didn't have those 2. However, this year they've got 3. So what that's going to mean is they're probably going to lose their cost plans next year. The reason that they're going away is because they're expensive. So if I have an advantage plan, remember I said that the company assumes all the risk. They receive a monthly capitation, they receive a monthly check to take care of every Medicare beneficiary, and they may lose money or make money depending on that person's needs or health costs. With the cost plan, it was different. Companies were paid a monthly capitation amount for beneficiaries, but they reevaluated at the end of the year. And if somebody used more health care than what they were reimbursed, the company got back more money, more expensive. Okay, so that's why they're leaving the market. The other thing that happened is there are so few people that have these plans in the United States. If you add up all of the other states and the number of people that are on, Minnesota has more than all the other states combined. Okay? 40% of our Medicare beneficiaries have them. Not true in the other states where they're sold. So that means there wasn't a lot of fuss. Okay? This isn't affecting a lot of people. So there wasn't a lot of mad people because there were so few people affected. So that's another thing that contributed to them going away. Okay? Let's see. Now, with your cost plans, the reason they were so popular is there's a lot of different reasons. You were kind of in the middle. You were allowed to use providers within that network and that company would help you pay. But let's say there was a specialist up in Chicago that you wanted to go see, and that they weren't in your provider network with, remember, it's Health Partners, Blue Cross, and Medica. Let's say they weren't in your network. You could still go to that provider in Chicago, give them your Medicare card, and then they could bill Medicare. You would be responsible for all the out-of-pocket costs Medicare didn't, but at least you had coverage. If you had an Advantage plan and you went out of the network and saw somebody that was not a provider and there was no out-of-network benefits for that provider or service, you'd be responsible for paying it all out of your own pocket. So you had more flexibility. You could also get your drug coverage through the plan or separate. Now, I don't know how many of you got it through the plan. Probably not a lot of you. Most of the time, it was cheaper for people to get it through a separate drug plan. You had that option. So remember I was saying when I was talking to that man this morning after the presentation, and we did his research, his drug coverage under the plan they enrolled him in was going to be $300 more a year. He didn't have a choice. So it has to, if it's an Advantage plan, it has to be good for your health and your drugs for it to be good. You can't separate them out. So he was better off to pay more for the health with supplement and then have a choice between those 28 plans, and he saved money by doing that. So you'll always have to do your drug research too to make sure how it's going to fit for you. It's not just about the health copays. Okay? Now, let's talk about Part D. This is the one thing that people never do anything about. If I have original Medicare and a supplement or a cost plan, I get on a Part D plan and I never change. How many of you changed? You don't be embarrassed to say. You guys didn't change, right?
No.
Did you guys change? Most people, they get on a Part D plan and they do nothing. Don't do that. You're losing money. You should do your Part D research every single year. And at the end, if anybody wants to see how to do it, I'll be happy to show you how to do it. But if you go to page 58 and 59 in the book, it walks you through how to do it. You go to the Medicare website, it has a plan finder tool, and you go to www.medicare.gov, don't do .com, because they're going to try to sell you some, it's .gov, and you're going to put in your Medicare claim number, your medications, your pharmacy, and if you're looking at just drug coverage, let's say you do original Medicare and a supplement, we did this together, this gentleman and I, earlier before we started, and it pulls up all 28 plans in order of cost saving. What's the cheapest, what's the second cheapest, and so forth. But if you don't do that, you're never going to know. I hope you don't mind me saying, the plan he was on, we had to go to another page, didn't we?
Yeah, it was that far.
Okay, it was that far down the list.
Yeah.
And it was his agent that chose it for him. But the agent isn't using this. They don't sell all those plans. So why would they look at that? They're only going to look at the plans they sell. That's their job. So you have to be a good consumer and you have to find it. You do not need an agent to do Part D. You can easily do it on Medicare.gov. You can easily enroll yourself right there on that website or calling the company directly. Make it a part of your Thanksgiving holiday. That's what I do at my house. Do everybody's research. And I will say, most people we change every year because every plan can change significantly every year. Sometimes you can save hundreds and sometimes you can save thousands of dollars. If you can't save, there's no reason to change. The gentleman I did earlier today, a lady, she could have only saved $75 a year, and in her mind, it wasn't worth it to change for $75. That's fine, but she knows that. So she's trying to be at least a good consumer.
Well, if that would,
So there are 28 drug plans that you can get separate, and if you have original Medicare, that's how you'd get your Part D. If you have a Medicare Advantage plan, it is a part of the package. Okay, so you have to get something that's good for both the health and the drugs. You're going to have a monthly premium. The premiums range from $15 a month to over $100. Don't assume that the higher the premium, the better the coverage. That is not true. That is true with Advantage plans. If I choose an Advantage plan, the lower the premium, the higher my out-of-pocket costs are going to be. The higher the premium, the lower the out-of-pocket costs are going to be. But with Part D, that is not true. It's a crapshoot because it's based on the combination of medications you're on and the pharmacy you use. And then it's going to sort them, and you may be on some really expensive medications, and that $15 plan may be your best plan. There's no way to tell unless you use that software to determine that.
I don't think
Yes.
we've ever had anything covered in 2 years on,
Under
on our
Part D?
Well, everything's generic.
It probably,
That we take.
yeah, what you'll kind of find too, though, is that even the generics, even though there's sometimes a deductible, some of the plans will give you generic medications at a lower price and not subject to your deductible. So you still may be saving money even though you haven't met your deductible.
Okay.
Yeah, it varies quite a bit, depends upon the plan. Now, it's not just cost. So when we were doing this gentleman's research, we were looking at the 28 plans, the cheapest, the second cheapest, and so forth. The next thing that we always want to do is look at what kinds of restrictions are there. And I like to call these yes buts. Yes, we cover this drug, but. And these are ways that plans can restrict when they give them, how often they give them, and et cetera. So the first one is prior authorization. Yes, we cover this, but we want to see evidence that you have the appropriate diagnosis to warrant this medication, that it's medically necessary for you. So you're going to have to jump through some hoops to get it. The second is step therapy. Yes, we cover it, but we want to see evidence that you've tried a lower price drug first and it didn't work. And a good example might be Lipitor. You're on Lipitor, which lowers your cholesterol. It's a brand name drug. If it was covered under your plan, but it had step therapy, they could say, well, we cover it, but we want to see that you've tried some lower price statins first. And we want to see evidence that it didn't keep your cholesterol lowered. You could have to try 2 or more drugs before they would cover it. So you may not want to hassle with that. You may be willing to pay a little bit more in premium and get a plan that doesn't have that. So you want to look at that. The last one is quantity limits. Yes, we cover it, but we're only going to pay for this many pills in this many days. So maybe they'll say, we'll only cover 1 pill a day, so 30 pills in 30 days. What if you're taking 60? You're going to have to show medical necessity and why you need above that standard daily dose. So you want to look at those. You don't want any surprises when you go to the pharmacy. Now, plans have lists of medications that they pay for, and it's called your formulary. When you enroll in a plan, you get your you get your card and you get a formulary booklet. Keep it in your car. If you're going to go to the doctor, take it with you. Doctors do not know the prices of medication. That's not their area of expertise. They're going to think about the drug they think is the best for you, and they don't know what the cost is for you. And so we want you to be good consumers. Every plan has to have at least 2 drugs for every classification of illness. The lower the tier, the less expensive for you. Now, you can't compare your plan to somebody else's plan because tiers are just how they sort your costs within your particular plan. One plan might have 4 tiers and another might have 3. It just really varies. But you wanna go with the lowest possible tier so that it saves you the most money. Now, remember I talked about Medicare Part B and the fact that it was income indexed. The higher your income, over 85 for a single or 170 for a couple, that you paid more for your Part B. That's also true with Part D as well. So if you're paying more for Part B, you're also going to pay more for Part D. So these amounts are in addition to the premium of the plan that you choose. Now, what is the standard benefit going to look like in 2019? Plans have a monthly premium. If you have either an Advantage plan with Part D or a separate Part D, don't get it deducted from your Social Security check. You can, and if it is, don't stop it. But the reason is, remember, I want you to reevaluate your drug coverage every year, especially. And if you do a Social Security deduction, it takes several months to start and several months to stop. And you could be paying double for a while at the beginning of the year. You'll get reimbursed, but if you're cash poor, or you have on a budget, it can be a hardship for you. So pay the plan directly. You can have it debited from your accounts. Now, plans can have a deductible. The max deductible in 2019 is $415. Many plans have a 0 or a lower deductible, and some will allow you to get certain medications that are not subject to the deductible, especially those lower priced generic medications. Once the deductible is met, then you're going to pay a portion and the plan is going to pay a portion. You're going to pay about 25% of the cost of the medication. So if it's a $100 medication, your copay will be about $25. You're going to stay there until you get into the donut hole or the coverage gap, and that's when your total cost, what you paid in the plan paid, go above that $3,820. Now, the good news for 2019 is the donut hole goes away for brand name drugs. There is no donut hole for brand name drugs. So you will stay at 25% until you get to the catastrophic benefit. The donut hole did not go away for generics, so you would go up to 37%, but you'll see that in 2020 that'll also go away. So in 2020 there will be no donut hole. You'll always pay 25% of the cost until you get into the catastrophic benefit, and then your copays go way down. Now when you're looking at how do I get to that catastrophic benefit, every month you get a statement from your company called an explanation of benefit form. It tells you where you're at. Are you in the deductible? Are you out of the deductible? How close are you to that catastrophic benefit? To get to that catastrophic benefit, it's not every cost doesn't go towards that. So for example, the monthly premium does not get calculated to take you up to that catastrophic benefit. Now, there is a program that a lot of people don't know about through Social Security called the Extra Help. Or low-income subsidy. This is a program that for people who have low to modest incomes can apply for and get help in paying for their prescriptions. There are some people who automatically get it. They don't have to apply for it. That would be people on medical assistance. It's an automatic bonus for them. Everybody else has to apply. The easiest way is to go onto the Social Security website. It takes about 10 minutes to apply, and you don't have to send any proofs in. Very, very easy. You hear back in about 2 weeks. It lets you know whether you're eligible and what your subsidy level is. If I'm eligible for a partial subsidy, my premiums will be lower, depending on what my subsidy level is. Instead of a $415 deductible, it's $85. And then instead of paying 25% and then going into the donut hole, you pay 15% of your medications until the catastrophic benefit. Much better deal. Now, if I want to know if it's 150% of the federal poverty level or lower. So if I'm a single person and my income is at or below $1,538, or as a couple, it would be at or below $2,078. That is gross, not net. So you have to add back in your Medicare premiums because even though you don't see that, it's still income for you. It gets deducted. They also look at assets, and this is liquid assets. It's not your house or your car or any personal property or homesteaded property. $14,100 for an individual and $28,100 for a couple. We can help with that application. It doesn't take us very long. I would not do the hard copy application because a lot of them are kicked back because they have to be scannable. So you can do it online yourself. We can help you to do it, and it'll significantly drop your drug costs. It may not be you, but think of the people that you may know who might be eligible for this subsidy, and they can always call us and we can help them through that process. Now, an example of how that subsidy might work, so if I get a partial subsidy, I'm going to get, depending on my income, I may get a 25, 50, or 75% subsidy. And that subsidy is based on the basic portion of the Part D plan. So Medicare Part D plans, there's 28 of them. They can either be a basic benefit or an enhanced benefit. A basic benefit means it meets all of the basic requirements for Part D. An enhanced means it meets those and it has some additional benefits. Doesn't necessarily mean it's more expensive if it's enhanced. Sometimes it's even lower. But you only get the percentage off the basic portion of the premium. So if it's an enhanced plan, then it's $50. Maybe 40 of it's the basic and 10 is the enhanced. You only get your percentage off that $40. So for example, if it's a $60 plan and it's basic, and I have a 75% premium, or a 75% subsidy, I pay $15. And then my drug costs are going to depend on whether I have a full or partial subsidy. And here's the information about how to apply it. Now, people who have a full subsidy would be people who are dual eligibles. They're on Medicare and medical assistance, both. And the federal government knows that because the state sends their name up in a data drop each month that says so-and-so is on medical assistance. They automatically then contact the person's Part D plan. They're on a full subsidy. They go to the pharmacy and they automatically get the lower costs on their medication. They pay no premiums for up to 6 different plans. They're called benchmark plans. They can choose any of the 28 plans they want, but if they want a 0 premium, they have to choose one of those 6 plans, and we want to make sure that they choose the one that covers their medication the best. They're going to pay no premium for them. There's going to be no deductible. There's no donut hole, and they just have co-pays then. Talked about the benchmark. Here are the benchmark plans. There's 6 different ones. These are available to people who are on Medicare and medical assistance, and they can get it for a 0 premium. Now the cost plans are leaving, so we know that as of January 1, if you have a Medicare cost plan, you live in Renville County, you will no longer be able to have that plan. We know they're popular in Minnesota because you had a lot of flexibility. So if you were a snowbird, you could go down south, take it with you, and still use your Medicare benefits if there was not a provider within the network. I could get my drug coverage through the plan or not through the plan, whichever was cost effective for me. In Minnesota, if you look at this graph, 260,000 of those people have Blue Cross. The next would be Medica, and then Health Partners. We don't have a lot of Health Partners here. It's more up in the metro area because of the Health Partners clinic. Most of the people in our area, it's Blue Cross, and then the second would be Medica. And we talked already about why this is happening, but let's talk a little bit about deeming. So companies were allowed, if I lived in one of those 66 counties and I was losing my cost plan, companies were allowed by federal law to develop new Advantage plans. And if they developed an Advantage plan that met certain requirements, and I had my drug coverage either through the plan or through the same company, they could automatically enroll me in that plan. So what they had to do was they had to develop an Advantage plan. I had to have a cost plan that included Part D, or I had to have a separate Part D plan with my Blue Cross cost plan. If I had that, then they could automatically enroll me in a new plan. It's called deeming. And Blue Cross did do that. Okay, so that happens with you. So what happened is they developed this plan and it met the requirements by the federal government that said it wouldn't cost you on average more than $36 more a month. So they were allowed to automatically enroll you in that. Now, we always want everybody to check, right? Because you want to make sure, are your medications covered? Can you use your providers? Is it still cost effective for you? So if you did nothing, starting January 1, if you were deemed, that's your plan. That's your health and that's your drug. Let's say you weren't deemed. Let's say that you had a medical plan that includes your drug coverage, but they didn't move you into a new plan. Starting January 1, if you did nothing, you would be back to original Medicare and have no Part D. If, though, you had a cost plan and a separate drug plan from a separate company, what would happen is you would go back to original Medicare and have Part D. Okay, so it really depends on your situation as to what happens January 1. But we don't want people waiting until January 1, right? We want them to do something before that to make sure that that's the best choice for them. So you've got some decisions to make, and if you look in the book, there's some charts that'll kind of walk you through what your options are. I think you really have to think individually. Cost, convenience, coverage. What can I afford? How much health care do I need? How flexible do I want it to be? How comprehensive do I want it to be? It is always easier to go down in coverage than up. And if you're losing your cost plan, you're getting guaranteed issue rights. You may never get them again. So if you think you want supplement insurance, do it now. You may never get the chance again. Does that make sense?
But we could, if we do that, we could opt out of that later?
Yes.
Okay.
Yes, every year during open enrollment, you could decide, you know what, boy, this is not working in my life, and so I think I do need to go to an Advantage plan, or maybe a new plan is developed in your area that you like, and then you could certainly do that, yes.
Okay.
Where the problem becomes the opposite way. You can always apply for supplement insurance, but if you're outside your guaranteed issue right period, it'll go through underwriting. And you may get it if your health is good, but it's that risk that you take that it's not a guarantee, okay? We talked about that. Let's talk about dates, because there's a lot to think about, right, in a short amount of time. So the open enrollment started on the 15th. If you do nothing and you lose your cost plan, come after December 8th, which is past open enrollment, you have a special enrollment period. You have until the end of February to choose new coverage, because they want to give people a second chance. It's not your fault that it's leaving. What will happen, though, is instead of it starting January 1, if I enroll, let's say January 5th, it's not going to start till February 1. Now, as long as you roll in December, it will start the first of that next month, but we don't want you to delay. So that's your special enrollment period if you're losing your cost plan. Now, if you're losing your cost plan, you also have those guaranteed issue rights, and that goes until March 4th. Let's say that you decide to enroll in an Advantage plan, January 1. And February 1 comes and you're like, oh my gosh, what did I do? I really wish I would have gone to a supplement plan. You're still within your guaranteed issue right period.
And if we did that and we only took one rider, would we be able to add riders other years, or are we stuck with the riders we have?
Yeah, part of it is you can always easier to go down in coverage but not
Okay.
up. And it's going to depend on the company. Some companies are going to allow that, but it's just not a guaranteed right. When you
Okay.
change a policy, that they have the right to do underwriting. So it'd be something you want to ask the company about. Am I going to be allowed to add this later? And, it depends on the company. And it might go through underwriting then to even add a rider. Open enrollment goes till December 7th. And then the last part that's important to know is this is a new enrollment period starting January 1 that will allow you, if you have a Medicare Advantage plan, to change again. So people who have Medicare Advantage plans starting January 1 and every year after that until they stop it, you can change plans again the first 3 months of the year. So it means that I enroll in a Humana plan for January 1, and now I think, oh gosh, I really like that UCare plan, I should have done that. Then it will allow me one time to drop the Humana, go to the UCare plan, but then it's only a one time. Okay, and I have to have an Advantage plan to access that period. Now, remember I said if you enrolled in an Advantage plan and then you decided, oh, I wish I would have done supplement, you can drop the Advantage plan during this time, go back to original Medicare, and your guaranteed issue rights didn't end till March 4th. So that's why you could still do that.
Okay.
Now, not every plan is affected. Not every Blue Cross, Medicare, Health Partners plan is going away. It's just those cost plans for people living in those 66 counties. And we don't want to scare anybody. So we always, if people are unsure whether it's affecting their plan, they can call their company or they can call us and we can help them to determine that. Make sure you save all your mail. If you're losing your plan, you would have received a letter saying that you had guaranteed issue rights. We're having a lot of trouble getting additional copies from companies. They are not by law required to send you a new letter. And not every company is asking for that letter, but many are. So if you get supplement insurance, you may have to show the letter that shows you have the right to get it without health screening. So save all your information. Fraud and abuse. Oh, we're seeing lots of robocalls, lots of telemarketing things. And so please, anytime it's an incoming call, do not give out private information. They're very good. They're very savvy at this. And so they're taking advantage of our confusion right now. And so no matter who they say they're Medicare, hang up and call Medicare. If it's an outgoing call, you have control over who you're talking to. If it's incoming, just never give private information, no matter who they say they are. If you ever suspect any fraud or abuse, or you have any problems with that, that's something you can call us about. We can report it to the Commerce Department. We can report it to the police. We don't, it's not happening to us. When it happens to you, if your identity has been stolen, it can be, you can just be numb. You don't even know where to go or what to do. Call us. We can help you with that part. We know who to quickly call and how to take care of that. Now let's talk about a few more changes. We know the cost plans are leaving. We know that if I have extra help through Social Security, up until 2019, I could change plans whenever I wanted. I didn't have to wait till open enrollment, because if I had extra help, I could change plans. That's changing in 2019. If I have extra help, I'll only be able to change plans one time per quarter. Anybody not got their new Medicare card yet? If you haven't, don't panic. We do know that most Minnesotans have gotten their cards, but not everybody. So if you don't have one, I would say by around February, call us. We can help you to call Social Security to see whether it's been issued or not, because we are seeing a few people who haven't gotten them yet. We do have that new Medicare Advantage open enrollment period. That's that second period where people can choose a new plan the first 3 months of the year. Another change is starting this next year that if you have an Advantage plan, your annual notice of change and your evidence of coverage documents will come separate. You're getting a lot of mail right now, and everybody's throwing most of it away because it all looks official. And so, what I would say is if it's from your company or from the federal government, look at it. The rest of the stuff, you can go in the recyclable bin. But this will, at least they're not together, they'll come in separate mailings. We talked about the donut hole discount. The other thing I wanted to talk about was the new initiative to work towards reducing opioid dependency. 1 out of every 3 Medicare beneficiaries takes an opioid. That's really high, 1 out of every 3. So they're addressing it. two ways. They're going to be working with the medical community to try to help that you don't immediately go on those medications. What are some other things that we can do before we get to that point? And for people who are on them and at risk of abuse or abusing, how can we help them get off? What kinds of treatment can we provide? So you're going to start to see that your medical provider is going to really be taking this seriously because they're also being watched. It used to be, and some people don't realize this, let's say that I'm on a plan that has 4 tiers. And the medication that I'm taking is in the highest tier. It's a tier 4. There's one other medication that can be used for that that's a tier 2. But I've tried that and that doesn't work for me. I have to have that tier 4 drug. You have the right by law to contact your company and say, I want a reconsideration. I can't help that I can't take that tier 2 drug. I have to take that tier 4 drug. There's no other choice for me. I want you to give me that tier 4 drug at the tier 2 price. And you very well may be successful. Many people don't know you have the right to do that. They end up just paying the higher cost and not realizing that they have some rights. Now, what companies used to be able to say is, okay, we can do that for anything but our tier 1 drugs. They're already so low, we're not going to do that. And that's no longer the case. You have the right to ask for that exception or that reconsideration no matter the tier that it's on. We already talked about the fact that Medicare Advantage plans are going to be offering additional benefits. So things like adult daycare, things like transportation, home modifications, for beneficiaries where they feel that it would be medically necessary and their provider has agreed to that. It's going to take some time before we see a lot of that happen. It's going to start very, very slowly. Step therapy. Remember that was the yes, but. Yes, but. Have you tried something cheaper first? Now, right now, they can only do that with Medicare Part D medications. But Medicare Advantage plans are also going to be able to use that for Medicare Part B medications as well. Many people don't realize there's some medications that Medicare Part B pays for. Things like immunosuppressants that you need to take so you don't reject an organ that you've had a transplant. Medications that you have to get via IV, some chemo medications. Those are medicines covered under Medicare Part B. They can be very expensive. So Advantage plans will be allowed to see, have you tried something less expensive first before they automatically jump to that more expensive drug. We talked about the linkage line, so my service area is in the red all the way in southwest Minnesota, but we answer calls all around the state during this time of the year. During the rest of the year, so starting in January, your calls are prefix routed. So if you call in this area, you're going to either get our Mankato or our Slayton office. And we've got amazing staff. Right now, it's the first available person in the state because we want to make sure that people don't stay on hold any longer than possible. Questions? Anything that people are wondering about or about Medicare in general, or about losing your plan, or what to choose? Do you need to do jumping jacks?
I have a question about network.
Yes.
When I went online to figure out what mine was,
Yeah, so and it's so important. And before I talk about how you find out, let me tell you why it's so important. So for example, right now, Blue Cross and Blue Shield has this new PPO plans. If I live in Brown County and I choose that PPO plan that's available to me in Brown County, I can't use Allina Hospitals, which is in New Ulm. So it's a problem. And so